Ashley Miller with Weatherby Healthcare. Dr. Kusnezov is an orthopedic surgeon who is a staple on weatherbyhealthcare.com, where he shares great knowledge about his experience working with locum tenens. Thank you so much for joining me today.
Thank you, Ashley.
Doctor, I have a great topic to talk about today. Let's get right into it. It's a scary, unfamiliar world following residency. So in your opinion, what should all physicians focus on right out of residency?
Number one, I would always say focus on just being the best physician you can be. Delivering good patient care, doing a good job in everything that you do. That's going to really set the tone of your practice and your reputation, and reputation spreads very quickly. So you definitely want to do the best you can, put good word in patients' mouths through your walking billboards. I think beyond that, you also want to, do what you're passionate about, and do what you like doing and not necessarily what you think you should be doing. If you want to narrow down and focus more on, among orthopedics on doing trauma or a more general practice or sports, don't feel obligated just to do what you were trained to do, as long as you're comfortable and competent. And then lastly, I think, being organized is very important early along, especially because, among locums, a lot of the jobs are kind of patchwork. And so making sure that you are following through with credentialing in a timely manner, that you are on top of your licenses, that you have committed to dates that you can make in time. I think that makes a big difference, and that also adds to your comfort, but also to your reputation as someone who's reliable.
What was your personal experience your first year?
I was chomping at the bit at the end of residency. I mean, I was already trying to credential with locums companies, and they were saying, "Oh, you're still in residency." But I hit the ground running. I trained at a very busy level 1 trauma center, and so I immediately found the busiest level 1 trauma center I could on the outside, and it was busy. I mean, it was there were probably 6 cases a day every day, and I would be there, treading water. It was real kind of trial by fire, but I think that, like I said, it was something that I talked about earlier that I love to do. I was very passionate about it, still am, and I think I delivered excellent patient care, and it was a very rewarding experience. And from there, I think straight out of residency, I think I would pick up big jobs, small jobs, pretty much whatever I could get, kind of to get that sense of what the job market was like. What various jobs represented, and what I thought a good compensation structure was.
Well, now that you're an experienced orthopedic surgeon and have worked with locums for a short while, what do you wish you had known following residency?
So I think having 4 years under my belt now, the advice that I would give coming out of residency is really to, expect the unexpected and be prepared. We often train at very well-equipped, busy academic institutions, and we are used to having every form of support, and ultimately our surgeries or our patients are staffed with other physicians who are easily on call with you. And I think when you get out and you're on your own, you lose kind of that safety net. And so I think it's important to be prepared for and have contingency plans. I've been in many situations where they're just, things are in surgery where we are shorthanded, or we're individuals are unfamiliar with procedures, or we don't have the correct instrumentation, and you have to be very versatile in order, again, really to deliver the best patient care.
You've stressed in many of your articles that it's important to know what you're worth. Well, that's hard as a new physician. So if you choose to work locums right out of residency, what advice can you share on choosing the right assignment that will help you achieve your financial goals?
Right out of residency, any assignment will help you achieve your financial goals. I mean, you're going to be going from making pennies on the dollar to more money than you know what to do with, regardless of if it, comparatively is lower than another assignment. I think that, locums is very flexible and it's very well compensated. And so I think that's 2 of the big appeals to a lot of physicians, including myself. My advice would be to get your shoe in the door, to be someone who is, ready to take assignments and jump right in. And companies will respond to that, and hospital systems will respond to that. How eager you are to work there, and how responsive you are to emails and credentialing and that sort. And then beyond that, once you've kind of had a few jobs under your belt, you'll have an idea of what to ask for, and you can kind of stair step toward whatever goal you might have.
I'm sure this is going to be extremely helpful to physicians wrapping up residency. So thank you for taking the time to share your knowledge with them.
Yeah, of course. Thanks for having me, Ashley.